Hello, professors, classmates, and guests. My name is Dominique Smith, and I'll be discussing my capstone project, Increasing Diversity in the Imaging Professions through Vocational Awareness Programs. Before I delve into my project, I thought it would be important for me to take time to tell you a bit about myself. I've worked in various roles in imaging technology for over 20 years. After working in an administrative capacity for several years, I decided to pursue a clinical profession as a radiologic technologist. I'm currently completing my final quarter at Bellevue College. Yay! And I'm working as a lead mammography technologist at the Swedish Ballard Breast Imaging Center. I really consider what I do not just a job, but my calling. It really is my passion. And for this reason, this project has a very high personal value. The ultimate goal of my capstone project is to increase racial diversity in the imaging sciences professions. The focus of my capstone project was to develop a presentation to educate high schoolers on the imaging sciences professions. According to the American Society of Radiologic Technologists, the field of imaging technology is one of the least culturally diverse workforces among healthcare professionals. In fact, out of 20 radiologic technologists, only 3 are likely to identify as a race other than white. The reality is that race, ethnicity, and culture frame our experiences in every facet of life. As an African American woman in the profession, I have at times felt isolated and excluded. This feeling of isolation has increased since I began pursuing opportunities in imaging leadership. The lack of diversity has made me feel that my race and gender are potentially going to be barriers to reaching my goals. I'm determined to use my platform to potentially ease the way for newer technologists that want to get into the field and eventually get into management. I fell into this profession by accident, really. I got a job working at my local community hospital as a clerk in a radiology department. At the time, I was a young single parent of 2 children trying to figure out a career path that would allow me to support my family while meeting my intrinsic passion to help others. Considering I had my first child in high school, this would have been a career option I really wish I knew about and pursued even earlier. I'm determined to use my platform to champion diversity by ensuring the imaging workforce reflects the various communities we serve and to potentially ease the way for technologists of color that want to pursue management roles in imaging. I knew that gaining organizational support would be essential to developing a program that would truly meet the needs of the organization and be well supported. And so I started my project by working with my mentor, Lisa Martino, to develop a list of key stakeholders. And then I reached out to each of those stakeholders to discuss my project proposal and gather feedback. I was actually able to meet with Dave Wilson, who is the director of medical imaging for Swedish Healthcare, in person. He was extremely enthusiastic about my project and positive about the implications for improving diversity, not only amongst imaging professional, but across our organization. During this phase of the project, I also connected with David Grant, who's the Diversity, Equity, and Inclusion Workforce Development Program Manager, and he's part of the Swedish Office of Health Equity and Diversity and Inclusion team. This meeting improved my knowledge and understanding of the strategic objectives of that office, their long-term goals, and the ongoing projects that they were currently working on. Mr. Grant reinforced my belief that raising vocational awareness was really crucial to creating and sustaining a diverse workforce. Mr. Grant was also very supportive of exploring expansion of the scope of the project in the future to include development of a mentorship program. After meeting with Mr. Wilson and Mr. Grant and getting the go-ahead to start the project and work as an agent of the organization, I moved on to step 2, which was finding an audience for my presentation. I conducted research on the demographic and racial makeup of high schools in Seattle proper. The goal of this research was to determine schools that had higher levels of racial diversity and offered health occupation courses as well as AVID programs. Based on my research, Garfield High School was selected to pilot this project. I created a formal document outlining the objectives of the presentation and detailing the planned content for the presentation. Through this inquiry process, I was able to gather information about the preferred presentation method. Due to pandemic restrictions, in-person presentation options were limited, and there were very specific requirements for on-campus visits. Next, I went to work developing and designing my PowerPoint presentation, as well as developing a plan of analysis. I knew that it would be very important that I have a way of measuring the efficacy of the project. Next was delivery of the presentation. So I went to the high school and presented. And lastly was analysis of the data from the metrics that I had created for measuring the efficacy. There were essentially two parts to my strategy for metrics, for developing metrics. First was observation of audience behavior. During my presentation, I was just continually scanning the audience to gauge or to be able to identify their level of engagement. Additionally, during and after the presentation, I was able to, talk to students to get some real-time feedback. And that really yielded some very positive discussion. And I could tell by how many questions the students had that they were very engaged in the presentation. I developed two surveys. The first was a pre-presentation survey, and that allowed me to establish a baseline of participant awareness of imaging professions and their openness to considering the profession prior to me doing the presentation. The post-presentation analysis involved and allowed me to assess the efficacy of the presentation and increasing interest in the profession, as well as assessing if there was increased interest in more in-depth exploration of the profession, such as participation in a mentorship program, which is a long-term goal of my project. This is an example of the pre-presentation questions that were asked, as well as the survey results. You'll notice that for every statement, students were asked to identify whether they strongly agree, or strongly disagree, or just disagree. And then the results were categorized based on students that identified as white and students that identified as a race other than white. Data from the pre-presentation survey yielded two key findings that I think could be leveraged with the vocational awareness program. Only 50% of students that identified as a race other than white, compared to 100% of white students, were aware of the education and job requirements for the healthcare careers in which they were interested. Education is the most critical step to becoming an imaging professional. Lack of knowledge about educational requirements has been demonstrated to be a barrier to minority students pursuing healthcare careers. Education, training, certification, and licensing requirements were discussed in detail during the presentation. 40% of non-white students reported having no familiarity with careers in the field of imaging or radiologic technology. This was another key metric demonstrating the value of the vocational awareness presentation. Displayed are the results of the post-presentation survey. The post-presentation survey was conducted immediately following the presentation. The post-presentation survey yielded some pretty promising results as well, just demonstrating the value and efficacy of the vocational awareness program. Now, across all racial groups, a high percentage of students reported the presentation increased their awareness of imaging technology careers. A high rate of non white students were interested in having further discussions with college advisors and imaging professionals, about 80%, and participating in mentorship programs for imaging technology careers, and that was about 70%. I mentioned previously that 5 students contacted me following the presentation to get more information. Of the 5 students that contacted me, 3 were likely identify as non-white. We connected through social media, so while they did not self-declare that to me, based on what I saw on their social media, it does look that 3 of the people that contacted me out of the 5 were students of color. Now, 60% of non-white students would consider a career in imaging technology after the presentation, and that was an increase between the evaluation pre-presentation and then post-presentation. To truly be a champion of this new program and garner support, I needed to be able to speak confidently about the value of this program for the community, organization, and profession as a whole. I researched a variety of topics to ensure success of this project. The majority of my research focused on the efficacy of vocational awareness programs and increasing diversity in healthcare settings. I also spent time researching the best practices for creating effective surveys. Prior to creating the presentation, I reviewed many imaging profession awareness videos and online presentations from a variety of sources, including educational institutions, professional organizations, students, and technologists actively working in the field. This allowed me to identify trends and recurrent themes. I incorporated many of these themes in my presentation. No need to reinvent the wheel, as they say. I gained important knowledge from my meeting with Dave Wilson, the Director of Imaging Services for Swedish Healthcare System, and David Grant from the Workforce Development Program through the Swedish Office of Health Equity, Diversity, and Inclusion. Ongoing meetings with my mentor, Lisa, had a positive impact on the outcomes of my project as well. Lisa was a valuable resource because of her in-depth knowledge of organizational operations and resources. Many of the courses I've taken throughout the duration of this program provided me with foundational skills and knowledge that were essential to successful completion of this project. In previous courses, I've discussed implicit bias on perpetuation of health disparities, components of cultural competence, workforce diversity, key components of strategic human resource management, recruitment, selection, and retention of employees, performance improvement through cultural change, project management theory and practice, an overview of various modalities in radiology and radiation fields. I really believe the outcomes of this project are positive and have really positive implications for impacting diversity of the imaging workforce in the future. Vocational awareness presentations and programs will be a catalyst to a more diversified imaging technology workforce in the future. Utilizing resources from the Swedish Office of Health Equity, Diversity, and Inclusion to expand on this project and implement a full spectrum mentorship program is a logical and critical next step. Throughout this project and my entire educational journey, I've received a great deal of support. I'd like to thank all of my wonderful professors at Bellevue College for not only providing a high-quality academic experience, but also exhibiting a sincere desire for me to reach my highest potential, both professionally and personally. I'd like to acknowledge my project mentor, Lisa Martino, who is also my supervisor. I'd like to thank my children, Bria and Deshawn, for the ongoing motivation and support. And lastly, I'd like to acknowledge my husband, Corey, Throughout the 10 years I've been working on completing my bachelor's degree, he's been my biggest cheerleader and supporter.